unfortunately, as you can see, the numbers in the United States are at an all-time high and trending in a wrong direction. And we know exactly why that's happening as well. This is not a surprise. We predicted this, that with the fall, with people staying indoors, and without the kind of broad protections we know we need to take, such as masking, such as not gathering in large groups, the numbers will continue to rise. So this is not necessarily a surprise, unfortunately. And at the same time, we also know what we need to do to get the numbers under control. So we do need to not wait until the new administration, but start making changes now. You may have seen that today New York City has canceled public schools again. And so we are going backwards. We're not going forwards at this time as a nation. I think the lack of trust in science is at an all-time low, and our solutions will be successful if people trust in science, if people trust in a vaccine when it's available, if people actually take both doses of the vaccine when it's available, if they're offered. Those are things that we need to work on now to rebuild the trust. When we talk about masks, it's not a political issue, it's a science issue. And starting to understand how science drives decision making, and understanding and connecting the dots for the general public as well as our leaders, saying this is what the evidence shows, this is where we have equipoise or we're not sure. And based on what we know, we believe the following: avoid large gatherings, practice physical distancing, wear masks, stay home when ill, and self-quarantine after exposure. Those are simple things, and it's our job collectively as the media and as leaders to repeat those messages every chance we get. The CDC report today showed two reports of super spreader events, one in rural Maine at a wedding reception and another in the Amish community. And it's because those simple things that we know to reduce transmission weren't performed. When you have 55 people at a wedding reception, when the state limit is 50, you're doing something wrong. When you're not wearing a mask and you feel ill and you're going to work in a long-term care home, it's no surprise there was a secondary outbreak in a long-term care facility. These are things that we knew back in March, April, what we should be doing, and yet we're not doing it because we do not have that trust.